supportive housing is permanent housing in which housing assistance, that is long-term leasing or rental assistance, and supportive services are provided to assist households with at least one member, adult or child, with a disability in achieving housing stability. Eligible activities, also referred to as eligible cost categories, are allowable uses of continuum of care program funds. In short, it is what you're allowed to spend COC program funds on and expenditures that you can count on as match. Eligible cost categories are also referred to as budget line items. Those costs or activities are acquisition of a house, rehabilitation, new construction, leasing, rental assistance, supportive services, operating costs, homeless management, information system, and project administration. As you can see, there are many different types of costs eligible under the COC program. The COC program regulations specify which costs are eligible for which program component, and then vary from one program component to another. For instance, some costs are eligible under transitional housing that are not eligible under supportive services only SSO program component. Remember, a project funded by the COC program can be funded for only one program component. For example, a transitional housing project cannot be also a permanent supportive housing project. Projects that are funded under the joint transitional housing rapid rehousing component under those special guidelines include both transitional housing and rapid rehousing in its program design. However, each COC project may receive COC program funds in more than one eligible cost category, such as funding for administration, rental assistance, and supportive services. I'm going to mention two of these programs in Brevard County that I was very aware of. First one is Housing for Homeless. At Housing for Homeless, supportive housing, they care for those who are most vulnerable. In their 93 properties, they care for veterans, for families devastated by addiction or mental health problems, for those with housing vouchers, and for those who, through no fault of their own, have lost their jobs, their income, their health insurance, and had to choose between paying rent or paying for their health care or food for their family. So unsurprisingly, they chose their family. Their case managers are ready and able to assist residents in achieving their personal improvement plan, which enables them to accomplish their short and long-term goals. Their staff provides motivation through supervision, empathy, and recognition of tenant success. In addition, residents are exposed to the wide range of social services that are available throughout the county. They offer classes on budget management, offer substance abuse and mental health counseling, and have an employment specialist who works with residents who are willing to take advantage of this opportunity to turn their lives around. Housing for Homeless Supportive Housing also provides intervention services in crisis situations at critical stages with appropriate professional resources and effective case management. The range of services provided includes but not limited to housing placement, intake and assessment, case management and supportive services, rapid rehousing assistance, and access to a network of social service agencies and community collaboration. The other organization I'll talk about is Community of Hope. This program provides long-term subsidized low-cost housing to families that would otherwise be unable to afford it. These include families who are saving for a down payment of a house, going to school while working, or taking care of older children who have long-term needs. In 2014, Support HUD Rapid Rehousing Initiative Community of Hope purchased a 12-unit apartment complex. As they moved families in, it became evident these families coming to use rapid rehousing really needed permanent low-cost housing. Community of Hope, in partnership with Habitat for Humanity in Brevard, was able to purchase and renovate several homes in the city of Melbourne. Community of Hope provides the home as a low-cost permanent housing alternative to working families. To be eligible for a home, a family must have children under 18 years of age, have verifiable income, and be at or below 50% of the area's median income, which is based on family size. A Dedicated Plus project is a permanent supportive housing project where the entire project serves individuals and families that meet at least one of the following criteria at project entry: experiencing chronic homelessness, residing in a transitional housing project that will be eliminated and meets the definition of chronically homeless in effect at the time in which the individuals or family entered the transitional housing project, residing in transitional housing funded by a joint transitional housing rapid rehousing component project and who were experiencing chronic homelessness prior to entering the project, residing and has resided in a place not meant for human habitation, a haven, a emergency shelter for at least 12 months in the last 3 years, but has not done so on 4 separate occasions. Is receiving assistance through Department of Veterans Affairs funded homeless assistance programs and met one of the above criteria at initial intake to the VA's homeless assistance system. The COC interim rule specifies which eligible supportive services can be paid for with COC supportive funds. All supportive services provided must help program participants obtain and maintain housing. Services not specified in the COC interim rule are not eligible. Eligible supportive services are annual assessment of services, moving costs, case management, child care, education services, employment assistance and job training, food, housing, search and counseling services, legal services, life skills training, mental health services, outpatient health services, outreach services, substance abuse treatment services, transportation, and utility deposits. Remember, the program participant must meet eligibility requirements set forth in the NOFA under which the project was funded.